So, hello everyone, welcome to the part 2 of lower limbs, the new video. Okay, so we will start with the gluteal region today. So, the gluteal region is pretty much an important region clinically. We hadn't mentioned it before in the basics, but it is equally important topic. Okay, so the gluteal region consists of the muscles, the gluteus maximus, the gluteus medius, the gluteus minimus. These are one of the three important muscles in the gluteal region. Starting with the muscles, since the gluteal region is full of muscles, it is important to know which muscles are present in the gluteal region. Okay, so gluteus maximus, gluteus medius, gluteus minimus, then the piriformis. Piriformis is basically a very important muscle in the gluteal region, as it is also known as the key muscle of the gluteal region. Then we have the obturator internus along with the two gemini, the superior gemellus and inferior gemellus. Okay, and also we have the obturator externus, and last muscle which is very important because of its spelling, quadratus femoris. So what is important in this quadratus femoris? It is ratus. Okay, so in the front of thigh, along with the the vastae muscles and the rectus femoris muscle, we saw the muscle in group were named as quadriceps femoris, and the gluteal region, it is quadratus femoris. It is not quadriceps. Quadriceps comes in the front of thigh. So don't confuse between the two muscles. Okay, so these are the muscles of the gluteal region. Now, starting with the applied. Okay, at the first only, starting with the applied. Okay, so this is the gluteal region of the right side, for example. Just a second. This is the gluteal region of the right side. So the orientation of the figure will be medial, lateral, okay, superior and inferior. Now if this is a lateral side, this is the right gluteal region when see from the posterior aspect. Okay, this is the figure. Now divide it into 4 parts. Okay, so the 4 parts are basically the upper lateral, upper medial, lower medial and lower lateral. So basically, when we insert a syringe in the gluteal region, normally in the gluteal region we give the syringe, yes. So in which quadrant does we give the syringe? The upper lateral, upper medial, or lower lateral? So basically the upper lateral is the region where we give the syringe. So let me write it. It is the region where intramuscular injections are given. Okay, so the upper lateral region is most important for giving intramuscular injections. So why it is important in intramuscular injections? So basically, no rich blood supply in this region. Okay, and no major or important cutaneous nerves in this region. Since the no rich blood supply and no major nerves in this regions are present, so upper lateral quadrant is the most preferred quadrant where intramuscular injection should be given. So the syringe the needle should not hit the nerves or the blood vessel, so it can cause rupture, hemorrhage, and also if nerves are damaged, some sensory nerves are damaged, there will be sensory loss over the gluteal region. So therefore the upper lateral quadrant is the most important quadrant when we consider the intramuscular injections. Okay, so this was the applied of the gluteal region, the first applied. Now going further, we talked about the piriformis. So piriformis is also known as key muscle of gluteal region. So why the piriformis is known as the key muscle of the gluteal region? So now one important thing, the key muscle of gluteal region, the piriformis. Why? Because sciatic nerve passes below it, and also some vessels and nerves which are important passes above as well as below it. So one thing is important, the sciatic nerve. For now, just remember the sciatic nerve passes below the piriformis. So if piriformis gets damaged or piriformis is compressed, so sciatic nerve is compressed, so it can cause sciatica, or it is also known as the piriformis syndrome. Piriformis syndrome is basically compression of the piriformis muscle, and sciatica is compression of the sciatic nerve. But basically piriformis syndrome will later lead to sciatica. Okay, now it is also an important landmark. The piriformis is also an important landmark to give the sciatic nerve block for anesthesias. Okay, now we will go to one diagram. So we will basically draw a diagram of the hip joint. So why the hip joint? So basically the relations of the hip joint, which is given in the books, is very important, as it also talks about the position of various muscles in the gluteal region. It is also important in the hip joint point of view, but it is also equally important in the hip, when we study about the piriformis muscle or the gluteus maximus region or the deep fascia or like other muscles in the gluteal region. It is very important. Okay, so also the various like the nerve supply, the blood supply is also important. So we will study that diagram. So basically the hip joint diagram. So we will keep it simple. This is the hip joint. Okay, so we are drawing a diagram. Let's talk about if just a second. If the person's leg is like this is the anterior aspect, this is the posterior, this is superior, this is inferior, this is the gluteal region. Okay, so we are cutting a person from the lateral aspect. So let me give the orientation to the figure which we are going to draw now: anterior, posterior, superior, inferior. Okay, and we are seeing from lateral aspect, this aspect. Okay, so for example we are seeing the right side. Okay, so now this is the hip joint. So the bulkiest muscle in the gluteal region will be which muscle? On the posterior aspect, yes, it will be the gluteus maximus. Now the deep fascia continues with the gluteus maximus, as we know, and also we know like the bands on the gluteus maximus, like the middle part is thin and transparent. The deep fascia is not evenly distributed in the middle part of the gluteus maximus. In the upper and the lower part of the gluteus maximus there is thick deep fascia. So basically, let me show this in the diagram, then I will rub it. The gluteus maximus, basically this is the deep fascia. this deep fascia is sparsely located in this region and it deeply located in this region and this region. Okay, now the deep fascia also continues downwards in the downward aspect. Okay, so just like this. Now we also know a smaller muscle with respect to gluteus maximus is the gluteus medius. So gluteus medius will be more anterior or more inside the body. So basically gluteus medius is like this, and gluteus minimus is more smaller than the gluteus medius or the gluteus maximus. So gluteus medius will be more inwards like this. Okay, now we have also studied about the tensor fascia lata. Okay, so the tensor fascia lata will continue like this. Just with the highlighter I will show like this. Just a second. Just like this. So let me label. This is the gluteus maximus, gluteus medius, and gluteus minimus. Okay, this is the tensor fascia lata. Tensor fascia lata. Now the most important part, this piriformis. Where is the piriformis situated? So basically the piriformis is situated in midway between the gluteus minimus and the gluteus maximus. Okay, so we talked about this is an important muscle. So basically the sciatic nerve, let me trace the path of the sciatic nerve. The sciatic nerve basically comes like this, below the piriformis and go downwards. Okay, now one more important thing, the position of the obturator externus and the adductor magnus. So basically on the lateral aspect, the obturator externus will be situated like this, and let me obturator externus and the adductor magnus like this. Okay, and now the piriformis, the obturator internus with the two gemelli. So they will be basically situated more anterior to the sciatic nerve. This is the obturator externus, this one internus, and these are the two gemelli along with it. So let me just label it piriformis. This is the obturator internus with two gemellus. Okay, and this is our area of interest, the sciatic nerve. Now we talked about like some vessels or some nerves goes above the piriformis and some vessels and some nerves go below the piriformis. So basically it is like, just a second, I will tell you the artery. Which artery goes above the piriformis? So basically the superior gluteal artery. So the superior gluteal artery, basically, just let me draw it. Superior gluteal artery basically supplies, just a second, superior gluteal artery will go like this, will give a branch to the gluteus medius and basically go like this, and the inferior gluteal artery will go and supply, basically it will go and supply the gluteus maximus. Now above the piriformis will be the superior gluteal nerve. This is very much clinically important, superior gluteal nerve. So the superior gluteal nerve basically will go like this, supply the gluteus medius and gluteus minimus, while the inferior gluteal nerve will come like this and supply the gluteus maximus. So let me label this. These are the very much important arteries and nerves. This is the inferior gluteal artery and nerves. Okay, this is the superior gluteal artery and nerves. This superior gluteal artery is very much important, very much important clinical point of view. So this is the arrangement of muscles, the piriformis, the structures above the piriformis and structures below the piriformis. These are very much important. Okay, so for seeing the structures above the piriformis and below the piriformis, this was pretty much important in this figure. Okay, now coming downwards, like we are going to discuss one applied point of the superior gluteal nerve. Okay, so just a second, let me just give the heading. The heading is Trendelenburg sign. Mind it, it is sign. Okay, it is not Trendelenburg test. Test is for upper the lower limbs, varicose veins. The test is Trendelenburg test, but in the gluteal region it is Trendelenburg sign, the applied part. So just let me draw something. I will come back in a few seconds. Okay, so I'm back. So in the first figure, this one, this is a normal man. Okay, so this is a little funny diagram, but it is fine. This is the gluteus medius and minimus muscle. Okay, so basically this is a very basic schematic diagram, the gluteus medius and minimus. So in the first figure we see a normal man. So what I did, I told the man to stand on his left leg. Okay, so he stood on his left leg and it was completely normal. He didn't put much efforts for standing on the left side. Was like lift the left leg and standing on the right side. So this is the normal condition, first figure. And since the man didn't find any difficulty in standing on the right side by keeping his left leg in the air, so this is the normal. But in some cases, like what happens, like the opposite gluteus maximus, gluteus medius and minimus controls the opposite side. Like if I am standing on the left side, okay, and my right leg is in air, so the left gluteus minimus and medius is working to keep my body or in the pelvis in position. Okay, so we will discuss this case, you will be very clear with it. Okay, now I told another person with the affected gluteus medius and minimus of let's say I don't know the side. Okay, so basically he stood, I told him to stand on his right leg. Okay, he was completely fine standing on I told him to stand on his left leg. Okay, so he was completely fine standing on his left leg. But what happened, I told him to stand on his right side and keep his left leg in air. So when he tried to do this, he was like the pelvis of the man sagged on the other side. So what is this? So basically his right gluteus, let me write it, G medius and minimus is affected. So what is this case? So basically when we stand on one leg, okay, so listen, when we stand on one leg, like for example, don't look at this case, if we stand on the right leg and keeping the left leg in the air, so what happens is the right gluteus medius and minimus, okay, pulls the pelvis on the right side, okay, and prevents the pelvis on sagging on the left side as the left side is in the air. Same goes with if we stand on the left leg keeping the right leg in the air. So what happens is the left gluteus medius and minimus pulls the pelvis to the left side and keeps the pelvis in position and prevents it from sagging on the another side. Okay, so basically in this case, when I told this man, the affected person, to stand on his right leg, so what happened is, when he stood on his right leg, the pelvis dropped to the which side? Which should be the side? On the healthy side. Okay, on the right side. Okay, so the pelvis sagged on the right. The pelvis sagged. Okay, so we came to the conclusion that the right gluteus medius and minimus is affected. Okay, the pelvis sagged on the healthier side. The healthier side is the left side, because the left side is normal. And since, see, there's a trick. If the man is standing on one leg, okay, so in this case the right leg, and if the pelvis is sagging on the left side, so the right gluteus medius and minimus is affected. The pelvis is sagging on the healthier side, the opposite side is affected. This is the trick. Pelvis is sagging on the healthier side and the opposite side is affected. Okay, so in this case, right gluteus medius and minimus is paralyzed or affected. Okay, so this was Trendelenburg sign. So the gluteus maximus, the gluteus medius, the minimus, we talked about all the muscles. We talked about the the relation of the hip joint, not about the relation of the hip joint, but basically about the structure. Our area of interest was the structures above the piriformis and below the piriformis, the sciatica, then the piriformis syndrome. Then yes, I forgot to tell one thing in this Trendelenburg sign. Not really forgot, but the nerve supply was superior gluteal nerve, as we saw in this diagram. See, the superior gluteal nerve goes and supplies the gluteus medius and minimus. The inferior gluteal nerve alone supplies the gluteus maximus. Okay, so this was about the gluteal region. Now going to the popliteal fossa. So what is basically popliteal fossa? So it is the region behind the knee joint. Okay, basically this is the region behind the knee joint. Now talking about the boundaries of the popliteal fossa. Now for example, as in this figure, the gluteal region, we saw this figure. Okay, the gluteal region, if we extend this downwards, so we will see a diamond shaped fossa. Just let me just a second, I will just copy this image and I will paste it here. Okay, you already know this orientation of the diagram. This is not our area of interest. Okay, you already know superior, inferior, medial, lateral. Okay, so if we extend this figure downwards, we will see a rhomboid or a diamond shaped fossa, and then the leg starts. Okay, basically anteriorly this rhomboid fossa is the knee joint. So basically this is the popliteal fossa. So in the definition of the popliteal fossa itself, it is a rhomboid fossa. The rhomboid fossa comes. Okay, so now talking about the boundaries of the popliteal fossa. So we will talk about the right popliteal fossa. Okay, so right popliteal fossa, I will just give a orientation to the diagram: medial, superior, inferior and lateral. Okay, now talking about the boundaries, we have muscles in the boundaries. Okay, now remember this diagram. This is the diagram which you should remember. This is the basic diagram. Okay, so basically I prefer to draw like this. Since it is a rhomboid fossa, we will draw it in a rhomboid shape. Okay, so this is a basic schematic line diagram. Okay, so let me label it. Medially, on the superior aspect, we have the semimembranosus, and this muscle is semitendinosus. Okay, On the lateral aspect, on the superior aspect, we have biceps femoris, long head. Okay, but we will write biceps femoris to avoid any confusion. Okay, basically what happens, the short head and the long head just fuses and comes in the popliteal region. Okay, now on the inferior lateral aspect, we have the lateral head of gastrocnemius. Okay, and we have a small muscle which may be present or may not be present. It is the plantaris. Okay, and on the inferior medial aspect, which is here, the muscle is, what will be the muscle? The medial head of gastrocnemius. So these are the boundaries. Superior laterally, the biceps femoris; superior medially, the semimembranosus and semitendinosus; the inferior medially, the medial head of gastrocnemius; and the inferior laterally, the lateral head of gastrocnemius and the plantaris. Okay. Now, these are the boundaries. Okay. Now the contents are very much important, and the relation of the contents are pretty much important. So remember, I will just write first the contents, okay, and then we will draw it. Okay, contents are popliteal artery. Mention it here as continuation of femoral artery. Okay, just to mention it. Then the second content is popliteal vein, and the third main content is the like the tibial nerve, and fourth main content is common peroneal nerve. Okay, these are the main contents, and one content which is the most important and which many people tend to forget is popliteal pad of fat. We shouldn't forget the pad of fat basically. Okay, now we will draw it in this figure itself. Okay, just I will copy this figure. Okay, so giving a short orientation, this is the orientation of this figure. So we talk about the popliteal artery, popliteal vein, tibial nerve. Okay, so basically this relation, let me just highlight the relation of this three structures are important. Okay, so the popliteal fossa is divided into three parts. Okay, the upper, middle and the lower. Okay, so in the upper part the relation is AVN. Okay, in the middle it is NVA, and also in the lower it is NVA. So what is this AVN, NVA, NVA? So basically it is the artery vein nerve, nerve vein artery, nerve vein artery. So which nerve? It is the tibial nerve. It is not the common peroneal nerve. Common peroneal nerve goes laterally. Yes, we know that like the tibial nerve and common peroneal nerve is divided, and it the common peroneal goes to the lateral aspect, and the tibial nerve goes deeper and it supplies the the leg region. Okay, so basically the common peroneal is out of syllabus. It is not out of syllabus. It is out of the our area of discussion, though we will draw at the first the popliteal nerve, it's the common peroneal nerve itself. So basically the common peroneal nerve gets divided and goes on the lateral aspect like this. So let me just mark it, the common peroneal nerve. Okay, so how to draw this AVN, NVA, NVA structure? So basically it is very easy. just at the first draw the popliteal vein. Okay, so the popliteal vein is somewhat like, you should draw it like this. Okay, just a second, a slanting one, not a too slant, but like this. It should be just, okay, just a second. Okay, now it's perfect. Then draw the popliteal artery. Okay, popliteal, how to draw? So you should draw like this. Just a second. Okay, you should draw like this. And the the tibial nerve. So draw the tibial nerve like this. Okay, so now this is the basic of drawing the popliteal fossa contents. Okay, so let me mark this. This is the upper 1/3 of the popliteal fossa. This is the middle 1/3 of the popliteal fossa, and this is the lower 1/3 of the popliteal fossa. So as we have said, AVN, popliteal artery, then the popliteal vein and the tibial nerve. In the middle 1/3, the relation are reversed, NVA. So popliteal nerve, then the popliteal vein, the tibial nerve, the popliteal vein and the popliteal artery. Then in the lower 1/3, the popliteal nerve, popliteal vein, popliteal artery. Okay, so how to draw? First we will draw the popliteal vein a bit slanting going to the lateral side. Then below it we will draw the popliteal artery. Then on the superficial aspect of all these two structures we will draw the tibial nerve. Okay, so these are the contents. And to show the fat, so basically the fat will be present like this all over the popliteal fossa. So this diagram is a perfect one to show the contents of the popliteal fossa. We have shown the popliteal artery, popliteal vein, the tibial nerve, common peroneal nerve. Then we are showing the popliteal pad of fat. So popliteal pad of fat. Also I will write the contents here. This is the popliteal artery, continuation of, yes, femoral artery. This is the popliteal vein. This is the which nerve? This is the tibial nerve. Yes. And the common peroneal we have earlier showed, and the popliteal pad of fat, and the relations AVN, NVA, NVA. So basically this was it for the popliteal fossa. Coming to the applied portion of popliteal fossa. So the applied portion is basically, just a second, the applied portion is basically pulsations can be felt of popliteal artery in popliteal fossa. Okay, and this occlusion of artery can cause a very major disease in the lower limbs, the gangrene. Okay, because this is one of the most important artery in the to go in the leg region. Okay, so basically it continues ahead of from the femoral artery in the thigh, then the popliteal artery in the popliteal fossa. Okay, and then it divides into the anterior tibial artery and the posterior tibial artery. So anterior and posterior tibial artery are very much important in the leg region, to supply the leg region. So occlusion of the popliteal artery, let me write this also, occlusion of popliteal artery can lead to gangrene. Yes, so this was applied part of the popliteal fossa. So now going to the back of thigh. What are the muscles of the back of thigh? What is the importance of the back of thigh? What is so special about the back of thigh? So basically, just to write an important point in the first. The back of thigh muscles are also called as hamstrings. Hamstrings muscles. Okay, so what are these hamstrings muscle? So basically the hamstring muscle are we saw in the popliteal fossa semitendinosus, okay, semimembranosus, then the long head of biceps femoris, and then we have the adductor part of adductor magnus. The adductor part of adductor magnus. So there's a difference between the back of thigh and the hamstring muscles. So the difference is the muscles are same in the back of thigh, but an extra muscles comes under in the back of thigh. It is the short head of biceps femoris. Okay, so it comes under the back of thigh. It doesn't comes under the hamstring muscle. Hamstring muscle are basically a specialized group of muscle which are like they have more characteristics in common. The short head of biceps femoris doesn't matches the characteristics. So what are the characteristics to be a hamstring muscle? So basically the characteristics are, okay, all the muscles of hamstring muscle, all muscles of hamstring originates from ischial tuberosity. Okay, the tuberosity which is present on the hip region or the like on the posterior aspect of the hip bone. Okay, all muscle originates from ischial tuberosity. Then all muscle inserts on one of the bones of leg. Okay, then the third point is the nerve supply. Nerve supply is tibial part of sciatic nerve. Okay, then they are flexors of knee and extensors of hip. Okay, so these are the four characteristics of hamstring muscle. The short head of biceps femoris lack this characteristic and therefore it comes under the back of thigh and not under the hamstring muscle. So basically it doesn't originate from the ischial tuberosity. That's the difference. So now going to one of the applied part. Okay, to the applied part, as we have shown earlier, I didn't explain that part, but we have shown here. Just a second. Yes, the sciatica. Let me just highlight it. The sciatica. What is sciatica? The sciatica is basically compression of the sciatic nerve, and compression of sciatic nerve basically will cause the common the tibial nerve and the common peroneal nerve to get compressed, and basically what happens is we can't use this muscles. We feel numbness or tingleness. Okay, tingling sensations. So these like this symptoms comes, therefore this is known as sciatica. Okay, the compression of the sciatic nerve. Now these four characteristics of hamstring muscles are very much important. Okay, one diagram is very much important when we discuss the hamstring muscle. The diagram is of the ischial tuberosity. Okay, the ischial tuberosity diagram. So the ischial tuberosity diagram, which shows the attachment of the hamstrings muscle on the ischial tuberosity, is very much important. So basically what happens, so let me just give you an orientation. We are discussing the right ischial tuberosity. So if you have seen the hip bone, you have surely seen the ischial tuberosity on the posterior aspect. So when we discuss about the ischial tuberosity, so basically the orientation of this video will be superior, inferior, medial, lateral. So we are discussing right ischial tuberosity. So let me draw it first, the ischial tuberosity. So basically you should draw a comma shaped figure like this. So this is the right ischial tuberosity. Okay, and this orientation is superior, medial, lateral and inferior given here. Then divide it into acute angle. Okay, and you are done. So basically when you draw the muscle, one muscle will come here, one muscle will come here, and also you should divide it like this. Then one muscle will come here. Okay, so basically what is this muscle and all? So this one is the semimembranosus. Okay, more on the lateral aspect is semimembranosus, comma is facing laterally, so on the lateral aspect superiorly is the semimembranosus. This one consists of two muscle attachment, the semitendinosus, and also what was on the superior aspect? Yes, the long head of bicep. Let me write it here, biceps femoris. And on the inferior aspect was the, yes, the adductor magnus. Okay, and also one applied, not applied, but it should be more more identified. So this is the subcutaneous part. So what is the subcutaneous part? It acts as a landmark, a bony landmark. We can feel it on us. Okay, so if paralysis of this hamstring muscles occur, we can't flex our knee and extend our hip, and the tibial part of sciatic nerve compression can cause these conditions. Okay, and further going more upwards, more superiorly, the sciatica can cause this symptoms. So we have discussed about the back of thigh. We have completed the thigh region. Okay, so that's it for today's video. In the next video we will discuss the leg, the retinaculums and all. Okay, so more important part will be in the next video, the mnemonics and all. It is very important. Okay, thank you.